Thank you so much for joining me, Elizabeth. So, I have got a long list of your awards and achievements, but I'll try to do my best by giving a summary. So, Elizabeth is a retired nurse, healthcare administrator, lecturer, and Emeritus Professor of Nursing at the University of London, West London. So, thank you for joining me today, Elizabeth. So today I wanted to start off by asking you to tell me about growing up in the 50s and what that was like and how you went into nursing.
Thank you very much. It's a huge honor to be invited to have this conversation with you. So I was born in 1947. I'm 73 now, and I was the outcome of an affair of two students while they were at Cambridge University,
Yeah.
and they didn't get married. My mother was of Irish heritage but born in this country and was studying classics. My father was studying law, and he was Nigerian. So my mother decided to drop out of her studies, even though she was offered support. And it was difficult in that era, if you can imagine, the late 1940s. My grandparents, whilst knowing that my father was was a student, didn't know he was Nigerian. So the next shock they got was when they looked at the baby and saw it was a brown skinned baby.
Ah,
And my mother decided she wanted to try and be a journalist. That didn't happen. She studied to be a secretary. And it took longer than she thought to get herself sorted out to provide a home for me. So I spent the first 9 years of my life in a children's home run by the Catholic Church and nuns. It was called Nazareth House in Birmingham.
oh,
So that was the first, if you could say, unsettling part of my life. However, I was, on the whole, very happy there. It was where I decided I wanted to become a nurse because I had very bad eczema, and there was a particular nun who I called the White Nun. Now, all the nuns were white, but this nun wore a white habit instead of a black habit.
I
And
see.
she used distraction therapy to change my dressings for my eczema because it could be extremely painful if a nun just tore the bandage off, and I would cry with pain. This nun used what we would call distraction therapy. She used to joke, but use words that I thought, as a child brought up in this religious atmosphere, very rude. Words like bottom. Oh, she she got me every time. I'd burst out laughing. Before I knew it, the bandage was off, no pain. And do you know, I just thought this nun was the most wonderful woman in the world because I associated her with laughter rather than pain.
Okay.
Later on, I discovered she was something called a nurse.
Oh,
I
I
decided
see.
that's what I wanted to do, and I never ever changed my mind. That's what led me into nursing.
Excellent. Thank you so much. And what would you then say would be your greatest achievements to date? And what do you feel enabled those achievements?
In my personal life, becoming a mother and a grandmother. Despite the difficulties I had in my early life, I've managed to achieve that, and I'm very proud of that. Professionally, it's that I became the first ever sickle cell nurse specialist in the UK way back in 1979. I'm really proud of those achievements.
Excellent. And I also know you had a hand in the Mary Seacole statue.
Well, I was invited by Lord Clive Soley, and he is the gentleman who set up the Statue Appeal because he was approached by four Caribbean women who asked him, couldn't he organise better um, profile of Mary Seacole, that more people should know about her? What about a statue? So when he became a lord, he set about this and set up a charity, and he invited me and 10 other trustees, and I became the vice chairperson of the Mary Seacole Memorial Statue Appeal. And it took us nearly 13 years to raise £750,000 to erect that beautiful monument. So yes, that's something else I'm very, very proud of, being part of the team that successfully achieved that.
Fantastic. Thank you. So, what are your thoughts on the topic of health and racial inequalities? and the impact it's having on the Black, Asian, and minority ethnic groups?
I've always had a particular interest in health inequalities and its impact, particularly on the Black and minority ethnic groups. We know it impacts on other groups, but sadly, we're seeing the example of COVID-19. It's just been so shocking to see inequalities just unveiled, the layers of it like an onion, but actually very quickly. And the fact, I know we're now in the second wave, aren't we? But when that first wave hit, and to be aware of the deaths of health professionals and the over-representation of Black and minority health professionals. We know that COVID-19 affects everybody. I just feel anguish for anybody who has lost their life, who has currently still affected with long COVID, for example, and all the family members who've suffered bereavements. It's a dreadful illness. In addition to that, we suddenly realised there's this over-representation of deaths amongst Black and minority health professionals, and the communities are also um, more affected by the condition. And I know that there are investigations, inquiries going on, and I very much admire Professor Kevin Fenton's very eloquent addresses on this issue of public health, Caribbean British Director of Public Health.
Yes. And I believe as well, on top of that, there was the racial situations that became global. And I think it touched a lot of the BAME communities, BAME workforce as well. So it leads to my last question then, in terms of what would you like to see change and improve within health and social care, particularly around racial equality, and what advice would you give our health and social care leaders?
Ideally, I'd like racism to just go away, and that people should not feel superior to another person because of their skin color. Now, that's, I'm afraid, a dream at the moment. However, what I want to see in health and social care organizations, firstly, is that they will not tolerate any racist behavior in their organization. Make that extremely clear, and take whatever action is necessary to address any individual who feels that they can get away with this. Secondly, and I think more organizations are doing this, looking at their staffing situation, and ensure that managers really do know whether members of their Black and minority ethnic workforce that they manage have any anxieties about the lack of career opportunities, promotion, and what impact is it causing them? A manager should know this situation for their staff. If they don't know it, they're going to lose their workforce, or they're going to have a very demoralized workforce. Whatever background we are, as managers, we have to have the humility to know that all is not well, but they need to find out from their staff and do everything in their uh, situation in authority to address this. And that starts from the chief exec all the way down to anybody who manages staff.
Absolutely. And I do have hope, given that we've had such a significantly monumental year. I do have hope that things are improving. So thank you. That is a real good challenge to our system leaders, but also a challenge to all our managers and across our communities, in terms of addressing some of those unrooted, or unrooting some of those racial inequalities. So thank you so much for joining me. It's been a pleasure to speak to you, and I hope that we can keep in touch for the future.
I certainly hope so. And well done in your organization. I will keep an eye on it, and I really do appreciate this invitation